is Startila Wright, and in this video today I will be going over tracheostomy care. I don't have much space to work with, but we're going to make it work. So the first thing that I would do upon entering my patient's room is go ahead and introduce myself to the patient. Hi, my name is Star. I'm going to be your nurse today. I would then go ahead and identify my patient using two different patient identifiers, such as name and date of birth. From there, I would perform hand hygiene and explain the procedure to the client. I would let them know that I was coming in to do some tracheostomy care and pretty much just clean the area around to prevent infection. The next thing that I would do is assist my patient to semi-Fowler's position. From there, I would inspect the area pretty much just with my eyes and see if they needed to be suctioned previous to me doing care. The next thing that I would do is I would use two separate containers, pour my normal saline into one and my soaking sterile solution in another. The next thing that I would do, again, is perform hand hygiene and then apply some clean gloves. Okay. From there, I would remove the oxygen shores and unlock the intercannula and remove it gently in a curvature nature. From there, and then I'm just going to allow it to soak in the solution. Okay. I would then next go ahead and remove the dressing around the trach. But unfortunately for me, this is my only one, so I'm just going to have to put this aside for now for video purposes. This is my only one. I'm going to need it for the cleanup, so I'm just going to set it to the side for now. Okay, from there, I'm going to go ahead and discard of these gloves. I would perform hand hygiene once again, and then apply my sterile gloves. Being sure to maintain a sterile field. I'm just gonna get the best view that I can. I'm going to go ahead. Okay. And from there. Okay, so once my sterile gloves are on, I'm going to go ahead and discard of this here. Okay, and I'm going to go ahead and open up my dressing, making sure that the shiny side is facing me. Sorry again, like I said, I don't have much room. Okay. And then from there, I'm just going to go ahead and go ahead and grab the contents from inside. Okay. So as that is soaking, I'm going to go ahead and get started with cleaning around the area. I'm going to go ahead and dip this into the hydrogen peroxide solution, and then make sure that I first start with cleaning the top of the area around just very gently. Okay, removing any crusts, debris around the area. I would discard of that. Next, I would go with the other one, dip that in the solution as well, and clean from the bottom. Making sure that I'm cleaning thoroughly. Okay, and discard of that as well. Okay, so as I'm allowing that to dry, air dry it, but I can also go ahead and roll this up and then just go around the area also. Okay, then I'm going to use the other side of this, just kind of pat dry. I'm going to go ahead and let that finish air drying. Usually, next I would take my cleaner and just kind of clean the cannula very well. The inner cannula here. Okay, and then I would discard of that and go ahead and place that back in, just as so. Okay, so once we have gone from there, reinserting the inner cannula at a curvature angle, it's secured there. I'm going to go ahead now and apply a new dressing under it, being very gentle here. Just going to kind of do one side at a time. Okay, once this area is all cleaned, just making sure that it's comfortable around. So the next thing that I'm going to do, unfortunately for me, I only have one string. So changing this out, I would go ahead and change these here. The ties, I would go ahead and change the ties. And then I would use the, sorry, I'm going to go ahead and grab this. Double knot method and place the 4x4 gauze right here, making sure that it's at least 2 finger space worth of room. And I will gently place that there to protect the patient's neck here from any type of like pressure from the string rubbing against it. Okay, so once it is taped in place right here by the knot, again, like I said, I would check the tightness. There's at least 2 finger space. I would go ahead and leave that there. Next, I would go ahead and begin to clean up my area. At this point, it's just okay to kind of discard everything. I would then go ahead and make sure that my patient's bed is in the lowest position. I would ensure that the call light is nearby. I would ask them if they had any questions or if they needed anything before I left the room. Once all of that is complete, I would then go ahead and provide myself with hand hygiene once more. And that concludes my video.